Good morning and welcome to the Hawai'i Health Data Warehouse Coffee Break Monthly Webinar Series. I'm Tanya Lowry St. John with the Hawai'i Health Data Warehouse, or HHDW, in the Office of Public Health Studies at the University of Hawaii at Manoa. We're going to use the next 30 minutes to introduce you to the new and improved Health Topics feature in hhdw.org. The presentation and demo should take about 20 minutes, and then we'll have a few minutes left for hands-on activity and questions so that we finish up in half an hour. In the last coffee break, we focused on the Build a Report feature. This is helpful when you know your data source and want to look up the latest data for the state in that source. We demonstrated the birth and death record data and also with the BRFIS data using the Build a Report feature in this coffee break series. And next month, we'll be demonstrating the 2020 PRAMS data. The Community Reports feature is a good resource when you want to look at multiple measures of health in a given community, like the count by county or race, ethnicity, or sexual or gender minorities, to see how they compare to the state as a whole. We'll demo this feature in future coffee breaks. But today we're going to talk about the Health Topics feature. And the Health Topics is a good place to start when you know your subject matter, but you're not really sure which surveillance systems have the information relevant to your topic area and matter, and you don't really want to go through all of the builder reports to try to figure out where your data might be. We launched the Health Topics module in 2019 with 10 topic areas and added an additional 9 topics in 2020. This year, we've updated the look and feel of the module, and we've added a new topic area, disability. Each topic includes a definition of the topic area with key terms, followed by sections which answer the following questions: why it's important, what it's known, who is at risk, and how to reduce that risk. You'll also find publications and resources, plus multiple data sources for you to explore. And those include our health indicator reports, Hawai'i Health Matters dashboards, customizable reports, and the how it is tracked area, which has hyperlinks to external data sources. And we'll look at all of these in detail during today's webinar. So what's new? Here's a quick view of our original set of icons. And here are our new icons with the disability button added. But it's not just the buttons. For those of you who are familiar with our system, we started out with information in a series of drop-down menus, or accordion menus is what we call them. With our upgrade this year, we updated the look of the accordions, and now we have which gave it a little bit more of a friendlier feel, but now we have redesigned the page so the information you need appears on a single page, making it easier to see the text and navigate to your area of interest. These arrows show where the information has moved on the page. So our description is now just right under the title, and information like how it's tracked is down here on this part of the web page. Our indicator reports and customizable reports have also moved to the right. So as you'll see it, you read on the left all of your text and information, and you do all of your clicking on the right. This allows you to navigate the page with less clicking and scrolling overall. Additionally, we've added a new reference menu that has the references for the text that we've used in the website, so you can see where we've gotten that information, and a call-out box that highlights publications and resources related to that topic area. Let's get started. I'm going to open my browser, and I invite you to do the same and to follow along. As usual, I'm going to start here on our homepage, hhdw.org, and I'm going to start by going up here to our Health Topics module. And here you can see our new 20 available health topics. For those of you who are a little like me, it's nice to see them all in a square box and not just that one missing anymore. But with our new disability health topic featured for this month, or featured now with our new health topic. However, since August is National Immunization Month, let's do our demo here on immunization and screenings. So we come back and we get to this page, and you'll see again that brief explanation about what it is and what any kind of definitions that you might need to better understand this topic area, followed by text of why it's important and what it is known, with an emphasis on what's known both nationally but also here in Hawaii, who is most at risk and how to reduce that risk. And here we have our reference bars before. You can also see when we last updated the page. We have our reference bar here with those hyperlinks. So if you want to go back and find more information about some of the statements that we've made above, that's easily accessible to you. And then we have this call out box here, which has some relevant publications and also resources. And all of these are hyperlinked to go back to the source page for these. We have populated these for you, obviously, but if you have some topic-specific resources or publications that you would like us to include, please let us know. So this is sort of our tech side with some external resources, bigger resources on this topic area. And then scrolling back up here, we have sort of our clickable side. And this is really where all the data is going to reside for this. And so we are going to take a look at our 3 sources of data, which would be our health indicator report, our Hawaii Health Matter dashboard, and our customizable reports. These are the ones here within HHDW writ large, our organization, and then these would be our external data sources that you would look at. We're going to look at these in order of configurability. So we'll start here with the Hawaii Health Indicator Reports. These reports are created as part of our as part of our community report series. So if we take a look here at routine checkup in the past year among high school students, and we click on this report, this brings us to a health indicator report in our system, and it's routine checkup in the past year among high schoolers. It's our summary report, so there's going to be 3 views. You'll see the data by race ethnicity for the past 3 years, and it looks like all of our other things in the system. When you roll over one of the graphs, you get the underlying data. You see the data by county. You see we've cleaned up our maps now, so you can see the data here by county as well, and then you can see it by sexual or gender minority status. And then scrolling down, you get how this is defined, what the data source is, our numerator and denominator. You can come up and view this a little bit differently by maybe if you want to look at just the data by race ethnicity, for example. So if we click on this one, then we get that same table before, the same chart, but now we get the underlying data table, and it acts like all of the objects within our system. So if you click on one of these, one of these little ellipses, you can go ahead and sort the data in the table, which will also sort it in the chart. That's a functionality throughout hhdw.org. And again, a little bit more information about that. So you can see we have a couple of different views here. You can also see what other health topics are associated with this. So while this is associated with screening for immunization and screening, it's also associated with health insurance and access to care. So if I wanted to look in that area, I could click on this as well. So this is just an internal health indicator report that we have. And I'm going to come back here to our summary report. And I should be able to click back over. Whoops. Okay, so now I'm clicking back over into our health topics. So here I can see with my breadcrumbs, I'm in health topics, immunization and screenings, and it's also here. So this is our one health indicator reports, and I like to say it's kind of the one with 3 views: by race ethnicity, by county, and sexual and gender minority status. So from there, we can go to something that's a little bit more configurable. If we take a look at our Hawaii Health Matters dashboards, and I'll go ahead and click on screenings again here. And these are picked dashboards that our staff has gone through and picked indicators within the Hawaii Health Matters system, which includes data from HHDW, but also from external data sources that are Hawaii specific, that then can give you a broader view of the data that we may have in our collection. So here, you saw before we just had 2 health indicators, but in this screening, you can see we have screenings for cancer. We have screenings for that. We have information that involves healthcare access and quality. So we have that routine checkup again, screenings for heart disease and stroke, infectious diseases, and weight status. So there's a bunch of different indicators here. And as we have said in the past, in this system, with each piece of data, you're going to have the current estimate plus a comparison to the prior value. So it's about the same. It's trending up over time, but not significantly. And this indicator is important because it's a Healthy People 2030 objective. It was also a 2020 objective, and we didn't meet that one there. We haven't met the 2030. We can go ahead and click on the indicator itself in here. And this would allow us then to dig a little bit deeper, and now we have a lot more views available to us. So here you have, this is our data, that little top line information, but you can see how the data is changing over time. You can see that the data is available by race, ethnicity, sex, and sexual orientation. By clicking on these little boxes, you can open up and see that data underneath. And with this system, as always, if it's red, it's significantly worse than the state overall, and if it's green, it's significantly better. So we would say that other Asian teens are more likely to have had a physical overall than the state as a whole, and other Pacific Islander teens are less likely. So you have the ability to sort of do a little bit more digging down here. This is available at the state and county level. And then scrolling down even further, you can see we have a lot of more information in this system that may be relevant to teens having physicals that you may want to explore. So just scrolling back up here for a moment, you can come back and we can go back to our pre-chosen dashboard that we created for you folks in our Hawaii Health Matters system. And you can see that even this dashboard is actually looking currently, it's limited by location to the state of Hawaii. You can go ahead and make some changes. So let's say I'm really interested in this data. What do we have for Maui County? And I can click on Maui County. I'll remove the state just for now for visibility. And I can hit search. And it will generate what we have for these indicators by Maui County. So if there is state county level available, then we can find that. And you'll see our comparison is now changed. So you'll have, for example, if we go back to our teens, now for Maui County, that value is 76.6 compared to the Hawaii value, compared to its own prior value, and so forth. So this is just one other way to take a look at the data. If you like it, you can always save a link to the search and share it with other people, and so forth. So that's a second way. So this is 3 ways. This is a lot more visibility. There's a bunch of different views here in Hawaii Health Matters. And then if you want to come and build a customizable report in our system, this is what I kind of like to think of as almost infinite views, right? So we have data for this in the BRFIS. We have BRFIS data on cancer screening. So you can scroll down here and see all the health indicators we have available for this. We can see other screenings and immunizations, so we'll just kind of take a look here. You can also see there is some PRAMS data on screenings and immunizations, which may be of interest to you. But we'll take a look here, and we're going to look at people who have had a flu shot or spray in the past 12 months, who are 65 and older, so I'll click on this. And this will bring us to an internal customizable build your own report. This will be the first time I've opened this system today. So I can hit agree to our data use agreement. And that brings me to the standard report that we have in our system for build your own report, which would be the last 3 years of data for the state as a whole. So these are adults 65 and older who have had a flu shot in the past 12 months. 2018, 19, and 20. Scrolling down here, I can see the data. Again, I can hover over, or I can look at the data table, and then I can see that, wow, there was a big increase. It went from 52.7% to 63.4% in just a span of 3 years. Of course, we all know what happened that year, and at that time in 2020, we were getting immunized for anything we could, right? So scrolling down here, you can see again, there's additional information about this, how the question was worded, the data sources, and so on and so forth. But the real power, of course, here with our build your own report is that you can customize this almost infinitely. So we go and click our modifier query button. We can see that now we can change it from a yes to a no. We can look at the time period for all the years that this is available. We can change and look at our different geography areas for which we have available. We can limit it by age group, by sex, by other demographic characteristics, and also by health behaviors or conditions. So we can look at people who have diabetes or have obesity, have ever been diagnosed with cancer, current cigarette smokers, and those that meet physical activity recommendations. For this demo, I'm just going to quickly look at this data among people who have had a flu shot for 65 years or older by race, ethnicity, and by sex. And I'm going to go ahead and change my charts to do a vertical chart with data labels, and I'm going to hit submit. And so now I can go through and look at, for these past 3 years, which race, ethnicity, and sex are most likely or least likely to have had a flu vaccine of those who are 65 or older. And again, I can come back and I can organize my chart this way, so I can see that it's lowest among other and Native American, Native Alaskan and American Indians. However, I can see here pretty clearly that Native, other Pacific Islander women have quite a low rate. If I want to do a quick comparison among women and get rid of the men here, I can just go ahead and click here on male, and now I can see the women a little bit clearer. So I can see that really other Pacific Islander women were about the same in terms of only about 41% getting their flu vaccine, and of those who are 65 and older getting their flu vaccine, compared to close to 65% of Japanese women. And again, we have those error bars so we can take a look and see whether or not those differences are statistically significant. That's kind of a neat little feature if you need to clean up, just to look carefully for a moment, that you can use. So again, because we can go by and modify this query over and over again, you have almost infinite views, infinite ways to sort of dig down into the data here. Here you're doing actual queries on a live data set. To make it easy, I'm going to come back up to health topics through here. And I'm going to come back to our immunization and screenings. And the last section that we have here on the side that's clickable is going to be this how it's tracked section. So of course, we don't have all the data. There's a lot of great data out there. So what I would recommend is, if you're looking and saying, well, what else is there available? We will have this information here. These are going to be linked to the external national references. So while we have Hawaii BRFIS data in our system, this would take you back to the national BRFIS system. Here's the CDC Places, which is a system that the CDC has done where they've taken BRFIS data and they've reweighted it to give you sub-county estimates for some 29 health indicators. So that might be helpful to you. There's also information in the National Health Interview Surveys and the National Immunization Survey. With all of our health topics in their new and improved health topic launch, we've also included the Relevant Healthy People 2030 objectives. So here we have what they have under vaccination for this, because that's what they're calling it in this system, is vaccinations. And then we also have for their preventive care what they have in there. So that's there as well. So whatever health topic you'll also have the Healthy People 2030 objectives or topic areas. So let's give you guys an activity. So I'm going to give you a few minutes to use your newfound knowledge of health topics, to use the health topics area to answer the following questions. How many adults in the US have a disability? If we're working on our disability topic, how many people in Hawaii have a disability? And what is the data source for that and the definition of disability? And then what are some sources for data on injury and violence? All right, let's take a look at the answers to these questions. So the first question is, how many adults in the US have a disability? So we'll come back over to our health topics. So we can either come here at our breadcrumbs, or we can also come up here and we will take a look at disability. One thing I didn't point out real fast is that, of course, if you want to email the page to someone, you can certainly do that here. You can print the page. Before we said you had to open everything up. This way it's nice and clear for you. But you can also save the page as a PDF to send somebody. So that might be useful to you as well. You can also, if you really love it, you can, share it on social media. Okay, so for this of how many people in the US, how many adults in the US have a disability? If we look under here under why it's important, we have about 61 million adults in the US have a disability. And then we go back and we talk about what studies show about people with disability, and we've got references for that below. The next question is, what % of people in Hawaii have a disability? So I'm going to look over here at the Hawaii Health Matters dashboards, and I'm going to say, well, what about disability among all persons? So if I click here, I can come to this dashboard that will give me health and disabilities, and they have a cognitive difficulty, hearing, self-care, vision, ambulatory, disability, living in poverty, but they have an overall persons with disability. So I'll click on this. That sounds promising. And the answer here is 11.4%. Our data source is the American Community Survey. And they define disability is that people who are limited in any activities because of physical, mental, or emotional problems. So this is one answer to the question of the percent of people in Hawaii who have a disability. Another way you might have thought about solving that is taking a look here. You might have seen, oh, BRFSS disabilities, and they have something that looks suspiciously similar because it's the sort of the same 6 series of questions that they're asking nationally to assess disability. And we could find adults with at least one disability. We can click here, and we can see that in 2020 in Hawaii, 20.4% of adults, or about 218,400 people, have at least one form of disability. And to find the definition for that, you can scroll down here and read in the data notes how the questions were wording. But that's adults with at least one visual, auditory, ambulatory, or independent living, cognitive, or self-care disability. And then the next question was, what are some sources for data on injury and violence? So I can come back here and come back to our health topics overall and switch over to injury and violence. And I can see here under how it's tracked that these are some different sources for information on injury and violence in Hawaii, or actually and nationwide. And I'm going to be including that information will be here on the final slide of the graphs of the presentation. So I wanted to thank you for attending today and invite you to join us next month on Tuesday, September 6th at 11 a.m. for our PRAMS coffee break, where we'll be covering the 2020 PRAMS data, including 80 new indicators from PRAMS, so we're excited about that. Also wanted to make a quick appeal to ask you to please take our survey. I've included a link in the chat, and there's also a link here on your screen, but we do an annual survey for the coffee break to see how we're doing, to help us gain new insight to make these better, and so we would really appreciate it. It's just a quick 9-question survey, should take you 5 minutes, and if you wouldn't mind, we'd be very, very appreciative. Thank you very much for attending, and we hope you have a great day.